And I did promise to you that when I come back at 1:15, we have an interview that is brought to you by Future Bits as we continue tackling these issues, these topics, and giving you insightful conversation here on RMR 89.7 FM every Thursdays at 1:15. Do you catch us here on the baseline? So today we are looking at antibiotic awareness. So every year in November, World Antibiotic Awareness Week is commemorated globally to raise awareness of antibiotic resistance and promote behavioral change, and to encourage best practice among general public, health workers, and policymakers. Following increase in the antibiotic resistance globally, the World Health Organization recognized antibiotic resistance as a global health issue, and it foresees a massive impact on mortality. The rise of antibiotic is leading to an untreatable infection which can affect everyone at any age in any country. It is the bacteria itself, not a person or the animal, that become resistant to antibiotics. Without urgent action, we are heading for a future in which infection and minor injuries could once kill us all. So today in the studio, as we are talking about antibiotic awareness, we are joined by our guest, Mr. Theodore. He's a former part-time lecturer in pharmacy practice at Rhodes University. He's a graduate with a B Pharmacy in 2016 and completed his MAM Pharmacy in 2018, titled Collaborative Health Literacy Development, a World Health Organization workplace health promotion approach to address tobacco use. He also additionally a higher certificate in healthcare service management. And also, this man has a lot of things, has achieved a lot of things. Good afternoon and welcome to the show.
Thank you for having me, Wendy, and good afternoon to all the listeners.
Yeah, today we are tackling a very important topic, which
Indeed.
is antibiotic awareness.
Yeah.
Right, so how do antibiotics work, firstly?
Okay, so first, before we start, I think it will be helpful to the listeners if we just there are two terms, antibiotic and then antimicrobial. And so the World Health Organization used to term it as Antibiotic World Awareness Day.
Mm-hmm.
And so now they've changed it to antimicrobial. And the reason for that is that antimicrobials encompasses both bacteria, viruses, fungi, and parasites, all those different types of microbes. And antibiotics just focuses on bacterial infections. And so that is the one that we're going to talk about today. So not antimicrobial, but specifically antibiotics. And so microbes are like very small, tiny organisms that we can't see with our eyes. And it is smaller than the tip of a pin of a needle. And so that's kind of the size of the type of organisms that we speak about today. And so antibiotics kind of came in by the famous Alexander Fleming in 1928, and so he came up with the first chemical that we called antibiotics to kind of kill bacteria causing infections. And so that's where the whole antibiotic thing came from. And so antibiotics it evolved over the years, and antibiotics work within three different ways. So the first one is antibiotics work to break down the cell wall of bacteria. And so it's like a balloon that pops. So when you take your medication, antibiotic, it pops the wall of the bacteria cell, killing it. The second way, it prevents bacteria from synthesizing proteins. And so through that way, the cell then can't survive and it will die in the end. And then the third way is it prevents its DNA from replicating. And so therefore preventing it from dividing and growing, and it dies. And examples of this might be penicillins, erythromycin, or ciprofloxacin. Those are the type of antibiotics. Yeah.
Amazing stuff there.
Yes.
So also I want to ask, when we speak of being a resistant to antibiotic, what does that mean?
Okay, so resistance, when we use the term resistance, we kind of we don't refer to the human being becoming resistant to the antibiotic, but actually to the bacterial cells. So that is the microbe within us that becomes resistant. Okay, and so this kind of happens when when we misuse and overuse antibiotics to a certain extent, and then the bacteria cells within us, they kind of become clever, and so they adapt. We call it mutations. They adapt, and then so that the drug, the medication, cannot kill them. And so they have a couple of ways in which they do that, and the first one is they prevent the antibiotic to enter the cell to perform its function. That's one way. The second way is that it prevents, it pumps out the antibiotic from the cell, so it can't perform its function. And then it also act by destroying the antibiotic. And then they modify the target, the place where the antibiotic goes to within the cell. So they then adapt so that the antibiotic can't stick to the cell and perform its function. And then lastly, it makes a nice protection layer around the target area where the antibiotic is supposed to work, and it can't work. And so that then happens that we then become resistant to medication that usually used to work for us. So if we had an infection previously and we took antibiotics, it might have worked, but now they might not, because that bacteria has developed and mutated in that way. We also get resistant, first-time resistance in that sense. So you become resistant to a medication that you might not have taken before, an antibiotic. And the reason for that might be because we might have digested an organism from the outside. So maybe we've eaten something, or from water or from soil that the resistant bacteria has been in, and then we ingest it and it goes into us. And then so the first time that we have a medication, we can also become resistant. So those are kind of the areas around it.
Okay, very insightful. So how long do antibiotics start to work?
So they can start to work almost within the first hour of taking them. That's when they reach their maximum effective concentration within our bodies. And so immediately after you take them, they start to work within an hour's time. That's when they start to work. And usually you should see effects from the first to the third day of you taking antibiotics. So it's not just a once-off dose. You have to kind of take it for 5 days at least.
Continue taking it.
Yeah.
So what can cause someone to be resistant to antibiotics?
And so there are kind of 4 factors that comes into play. So it's us, it might be our actions, it can also be the actions of the healthcare practitioners or the healthcare staff, and then also the food producers, so the farmers and those types of people. So first of all, farmers might, as I said, it's the misuse of antibiotics. So what farmers do is they inject their cattle or their chickens or whatever with antibiotics to prevent disease. The chickens are healthy, or the animals are healthy, so they inject them with antibiotics to prevent them from becoming sick, and then also to make them grow a bit faster. And so that's kind of one entry, and so those animals can become resistant, and so when we consume those products, we get the resistant bacteria. And then also we as human beings, when we have an infection, we can get a resistant bug from someone else or something else. But also if we're getting a medication from the doctor that might be not prescribing medication rationally, or accurately diagnosing us, or using the correct route of administration, dose or duration of the antibiotic, we can then become resistant to those antibiotics. And so it's really those 3 factors. It's our actions, the actions of the healthcare practitioner, and then the farmers, the produce that they make, that we then consume. So those are the factors that play a role in us becoming resistant.
Okay, so how it's important to finish a prescription even one feel better?
Okay, so usually you'll start feeling better after you take medication, and so most of us would be like, okay, I feel better, I'm not going to take the medication anymore. And so we really advise, when you do take antibiotics, for you not to do that, because it takes up the majority of infections take up to 5 days to clear out. And so even if you do feel better, you need to continue taking your medication. There are some severe infections that might go on for 4 weeks, and then you get treatments such as that for TB, and that can go on for months. And so it's really important for us to kind of to take our medications as they are prescribed, and then also not to share medication amongst us. So if someone else says, "Oh, I have antibiotics," I'll just share with you.
Yeah.
If that person is sharing medication with you, that means they didn't complete their course. So they haven't taken it, and you shouldn't take it. And the reason for that is because they might be infected with a different type of bacteria. And so they have a different medication, or that works in a different way.
Okay.
And they have not completed their course. So we try to advise people kind of like not to do that, finish their course, and be a bit more vigilant, and not like wash their hands with soap, get vaccinated, and make sure you adapt healthy lifestyles.
Okay. So what to avoid while you are on antibiotics?
Okay, so first of all, one thing that antibiotics do is when you take them, they kill both good and bad bacteria, and so that's where the first kind of side effect comes from. And so they disturb our digestive tracts. And so it's important for us to first, when we take antibiotics, for us to take probiotics. That preferably we take after we've taken antibiotics. We take that, and for us to drink a lot of water, because the side effects might they might cause upset stomachs, or cause diarrhea. And so it's good for us to stay hydrated when we take antibiotics, and then to eat fiber-rich foods and those types of things. It's also important for us to stay away from keep away from eating grapefruit, drinking alcohol or caffeine, or eating calcium-rich foods, because that affects the way in which antibiotic works within us. And then also it can aggravate the side effects of antibiotics.
Wow. Yeah,
Yeah.
we're learning a lot today. Definitely, your time is exactly 27 minutes past the hour, 1 o'clock. If you're just joining us, welcome to the baseline here on Armor 89.7. And we're still talking about antibiotics with our guest here in studio. But for now, let's just take a quick break. We'll be right back.
The baseline every weekday from 12 p.m. to.
Indeed, this is the baseline here on RMR 89.7 FM, and we're still in conversation with Theodore, talking all things about antibiotics here in studio today, and we're learning a lot. We are learning a lot. Theodore, we are still continuing. Our chat hasn't ended yet. Yeah. My next question to you is that do antibiotics have side effects, and how can one get rid of them?
Okay, so as I mentioned previously, the side effects, some side effects might stem from the fact that antibiotics don't just kill bad bacteria, it also kills good bacteria. And those good bacteria are mostly found, we can find them within our gut, so our digestive system. And they play an important role within our immune system and the way that our digestive system works. And so if that bacteria goes, then we might get stuff such as upset tummies, we might get diarrhea. Some antibiotics might also cause light sensitivity. So when we take them, we might react to when we go out in the sunlight. Some might even cause severe pains within our joints and those types of items. And then the most severe is when someone is allergic to antibiotics. And so when you become allergic, it can be very mild. So you might have itchy skin, a rash, you might cough or wheeze or something like that. So there's kind of an allergic reaction to it. And then it gets even more worse than that, and we refer to it as anaphylaxis. So that is a medical emergency, and so that's when you're really struggling to breathe and you're wheezing, and so you really need to go in and get that done. And so those are kind of the side effects that they get. And as I said previously, it's important for us to just keep on eating a healthy diet, stay hydrated when we take it, and then keep on eating probiotic foods such as yogurt and those types of items, and that will really restore the good bacteria within our digestive system again.
Wow, interesting. So do antibiotics weakness immune system, like weakens?
Yeah, it does. It does weaken our immune system, and there have been many studies that have been done that shows that it can actually weaken your immune system. And as I've said, it's because they affect the good bacteria within our digestive system, and it's our digestive system, and that really plays a role in our immunity, a big role in our immunity. So when the antibiotics kind of kill both good and bad bacteria, our immunity might take a dip also.
Okay.
And so it's good for us to then also think about how we can keep our immune system strong when we take antibiotics.
True.
Yeah, and that is we kind of just keep our stress levels down, because stress level makes our immunity our immune system become more weak. Eat more healthy food, get some rest, stay hydrated, and all those different types of things.
Okay, so can antibiotics be addictive?
No.
Okay.
They can't, and they're not really addictive in the sense where where you get direct physiological dependence by it affecting your central nervous system. You don't really become addicted in that sense, but you might get something called rebound infections. And so when you take antibiotics, as I said, it kills both good and bad bacteria. And so the good bacteria that might help you defend against certain things, that also gets destroyed. And so after you've taken antibiotics, you might get another infection that you might not have gotten before you took the antibiotic, and then you need another treatment, and so it continues on and on. So it's not really addictive in that sense, but you might have to take it more than once.
Okay,
Yeah.
I see. So can antibiotics, can I get them over the counter?
Yeah, so you can actually get antibiotics over the counter, but the ones you get over the counter, they refer to them as natural antibiotics, so they contain natural products. But I really wouldn't advise you to take that, because you really need to go and see a healthcare practitioner. As I said, they have to evaluate and see what type of bacteria you have in your system and which antibiotics you are sensitive to, because that helps them give you an antibiotic that will be most effective and with the least chances of you becoming resistant. And so I wouldn't advise you kind of getting over-the-counter medication, although there are a couple.
Shortcuts. We're all about shortcuts. Just go over the counter
and then get it done. And then you don't have to pay as much as to go and see a doctor or nurse or someone.
So what to do when one take an overdose of antibiotics?
Okay, so antibiotics, it's not really a concern when you overdose, but I would highly recommend you not to overdose on antibiotics for that reason. You don't really get an overdose. But if you do, you just you go, you don't really. It's not aggressive. You don't get really bad effects from doing it, but we don't advise you doing it. And if something happens, or if the side effects of that medication gets too much, then we do advise you seeking medical assistance.
So any final words for our listeners?
It's just to be aware of the type of be more hygienic in that sense. So let's wash our hands, especially during this time of coronavirus. I think it taught us a lot. So to kind of keep our hands clean and just be aware. So don't just, as sometimes doctors prescribe antibiotics because they feel like if you go to a doctor, and you don't get a medication, you feel like that's a bad doctor. And so sometimes they just give you medication because the antibiotics to make you feel better. And so if you don't get a medication, don't feel like the doctor is bad, and just to kind of be aware of the products and things we consume.
Thank you so much for joining us. Wow.
Thank you for having me. It was a pleasure being here.
It has been a great interview with you. Theodore is a PhD candidate in pharmacy practice here at Rhodes University. Thank you so much for joining us.
Thank you for having me.
We will see you next time.
Thank you. If you need any more resources about this, we have Samriddhi Sharma in the Faculty of Pharmacy that's doing amazing research on preventing resistance, so you can follow her also.
Thank you so much.
Thank you.
Theodore, a PhD candidate here at Rhodes University. Your time is exactly 25 minutes to the hour 2 o'clock. If you're just joining us, welcome.